The economy is at a critical juncture, and the upcoming Jobs Day report for September is set to reveal some eye-opening insights. With the recent jobs report and consumer price index indicating rising inflation and stagnant job growth in August 2025, the situation is dire. Across industries, job growth is in the red, and wages are failing to match the rising cost of living. It's a stark reality, and one that's largely being shouldered by women in the healthcare and private education sectors. Despite their efforts, these women are facing wage declines when adjusted for inflation. The gender wage gap, already a concern, has widened for the second consecutive year, leaving many questioning the sustainability of the current economic model. But here's where it gets controversial. The industries that are propping up aggregate job growth are primarily male-dominated. Construction and transportation, for instance, are experiencing real wage growth, but their employment growth is negative. It's a paradoxical situation, and one that hints at labor shortages impacting these professions. On the other hand, the fastest-growing industry in August was private education and health services, adding a significant number of jobs, almost entirely in the healthcare and social assistance sector. However, even in this growth sector, wages are failing to keep up with inflation, falling by a notable margin. The health services industry, a key driver of labor market growth over the past year, is now facing significant threats. Massive cuts to healthcare in the congressional Republicans' mega bill, alongside clinic and rural hospital closures, are set to lead to dramatic job losses. This industry, which is heavily reliant on immigrant labor, primarily women, is under attack from the Trump administration's anti-immigrant policies. Immigrants play a crucial role in healthcare delivery, yet they are overrepresented in the healthcare support workforce, which is projected to be the fastest growing over the next decade. With these policies, the nation's healthcare labor force is at risk, and this is the part most people miss. While jobs are being added in female-dominated occupations, wages are taking a hit. The 2024 Annual Social and Economic Supplement, ASEC, of the Current Population Survey highlights a growing wage gap for women working full-time, year-round. For the second year in a row, women are earning just 81 cents for every dollar a man earns. This gap, though seemingly small, could add years to the time it takes to close the gender wage gap. If the current trajectory continues, it will take until 2071 for the gap to close, a stark reminder of the systemic issues at play. Occupational segregation is a key factor in this widening wage gap. Low-paying occupations are often highly segregated, with women, particularly women of color, overrepresented. Black women, for example, are more likely to work in necessary but low-paying jobs, like nursing assistants, professional care aides. These jobs, though in high demand, tend to be low-wage and disproportionately employ women. The Trump administration's attacks on enforcement agencies, like the Equal Employment Opportunity Commission and the Office of Federal Contract Compliance Programs, further weaken workers' ability to hold employers accountable for discrimination and harassment. With reduced oversight, women are left more vulnerable in the workplace, expected to keep the labor market afloat with lower earnings and reduced protections. The August data paints a clear picture. The private education and health services industry is keeping the economy afloat in a stagnating labor market. But the women employed in these jobs are facing significant challenges. The Trump administration's policies threaten not only the growth of the labor market, but also pay equity. The upcoming Jobs Day report on Friday, October 3rd, will provide further insights into the stability of the labor market and the direction the economy is headed. It's a critical moment, and one that demands our attention and action.